The next question, the member for Scarborough-Guildwood.
My question is to the Minister of Health. I was listening to you very carefully because you know that in hotspot areas like in my community of Scarborough-Guildwood, the test positivity still remains very high. In fact, in the Morningside area alone, the test positivity is 1,200 per 100,000 people, which is 10 times higher than the provincial average. So that is a risk that you've just said that hotspots where there is risk will receive more. So my question to you is how much more? The Ontario Science Table says that hotspots should receive 50% more of the allocated vaccines. So it doesn't make sense to go back to a per capita distribution as if everyone bears the same risk, because we do not. Our communities that have high rates of positivity require more vaccines because that is safer for the whole province. We get the third wave under control. So my question is simply, will you listen to the science table and go back to the 50% allocation?
Thank you. To reply, Minister of Health.
Well, you're absolutely right. The test rates do remain very high in certain parts of the province, which is why we need to be very, very careful about any potential reopening, which has been argued on that side all morning. That is why we need to be very careful, and we are being careful. The strategy that we brought forward to allocate 50% of the vaccines into those hotspots is working, already an 8% higher level in hotspot communities versus non-hotspot communities. But we need to continue to allocate the vaccines, which we are doing based on population as we were before, but also based on risk. So the areas that have higher risk areas are going to receive more vaccines, which would, of course, include Scarborough.
Supplementary.
So what I'm seeking an answer to is how much more allocation will the communities like Scarborough receive? They need to know that for serious reasons. So when we look at the expansion of vaccines to 18+ across the province, that's good news, and I think that that's good. But over the weekend, I spoke to a gentleman in my riding. He's 96 years old. His name is James, and he lives by himself. He's homebound. He does not leave his home, but he has support that comes into his home through the LHIN. And he is still waiting for his vaccine, despite being eligible for the past 5 months as part of Phase 1. And James demonstrates that now is not the time to turn our focus away from the hotspots, because we still have vulnerable people who remain in the communities who are at serious risk. So, Speaker, there are thousands of homebound residents like James living in hotspots who are still waiting for their turn and want to know, will the minister commit to 50% more vaccine supply to hotspot communities?
Minister of Health.
Thank you. Going forward, the vaccine allocation will be based on population and based on risk. I know that Scarborough has had a number of hotspot areas and will continue to do so, but all areas are now receiving much larger quantities of vaccines because we now do have a reliable and steady supply of vaccines, and we want to make sure that people such as James do receive their first dose. So we are working with our paramedic services, with our home care services as well, to make sure that everybody who wants to receive a vaccine will receive a vaccine. So James will not be missed out. He will receive his first dosage and his second dosage at the appropriate time.